welcome everyone. I think we'll just start the webinar now, and if anyone wants to join, they can. I hope you're all doing well from wherever you're joining us from. Everyone in Toronto has already complained a little bit about the change in weather that we've had, snow in certain parts at the end of May. Before we officially start, I'd like to respectfully acknowledge that the Realize office sits on the traditional territory of the Wendat, the Anishinaabe, the Haudenosaunee, Métis, and the Mississaugas of the Credit First Nation. My name is Puja, Ahluwalia, and I'm the National Lead, Rehabilitation, Optimal Health and Wellbeing at Realize. Realize is a national not-for-profit organization that works with various sectors and communities to improve the quality of life for people living with HIV and other episodic conditions. One of the aspects of our work that we value is our relationship building with the HIV community and beyond. Soon after the beginning of the COVID-19 pandemic last year, we realized that we would have to come up with new ways to connect. And this is where the Real Talks were born. In June 2020, the first Real Talk with Realize was held, Tolerating Uncertainty in HIV and Aging. From there, we've explored advanced care planning, income security during COVID-19, barrier-free recruitment, ageism, and more. Most recently, we've been having conversations on race within the HIV and disability sectors. As such, during Asian Heritage Month, we decided to continue the conversation. This past Wednesday, we hosted a rich discussion with ACAS, Asian Community AIDS Services, and today we have the pleasure with partnering with ASAAP, the Alliance for South Asian AIDS Prevention. So thank you for being here today with us for this important and hopefully enlightening conversation. Now to the housekeeping side of things. This session is meant to be a learning opportunity and a conversation. Please feel free to write down any questions you have in the Q&A, and we'll hopefully have time to share them with the panelists at the end. We're hoping to have a formal conversation between the panelists and then questions from the audience. The town hall is being recorded, and by joining this session, you automatically consent to this recording. Anyone can opt out by withdrawing from the session. We will be offering a recording of the session and posting it onto our YouTube page. So if you do decide to opt out, you will have the opportunity to watch this session later. If anyone has any technical challenges, please reach out to Janet London. Her email is jlondon@realizecanada.org. Finally, all participants will mute themselves, including myself and the panelists, unless we're speaking. The conversation among the panelists is going to consist of 4 questions. Each panelist will have the opportunity to answer each question, and then if they'd like to respond to the remarks of the others at the end of each round. And as previously mentioned, we're hoping to have questions from the audience at the end of the formal discussion. So when Tammy Yates and I first started planning this Real Talk with Praney, the interim ED of ASAAP, we reached out to multiple potential panelists from across Canada who knew or were recommended to us. Interestingly, our invitations kept being politely declined, and regrets were accompanied by offers to connect us with ASAAP. Many people felt that they were not experts and therefore were not well placed to engage in discussions about the ways in which HIV might affect people from South Asian communities. For Tammy and I, this just reinforced the need for this conversation. In the end, we're lucky enough to connect with 3 amazing professionals with a wealth of experience engaging South Asian communities within and outside of the HIV sector. I would like to, however, acknowledge that we do not have a voice of a person with lived experience on the panel. The people we reached out to were unable to participate today. That said, the perspective of people living with HIV may be represented among those in attendance. And we extend an invitation to you to engage with us about your lived experiences at the end of this panel discussion if you feel safe doing so in this space. So now on to the best part. I'm excited to introduce Praney, Raheem, and Mohini. I invite each of you to introduce yourselves and share why you agreed to be on this panel. We'll start with Praney.
Thank you, Pooja. Hi, everyone. My name is Praney Anand. Praney rhymes with Renee, so Renee with a P, Praney. I use he, him pronouns. I'm the interim executive director at the Alliance for South Asian AIDS Prevention, or ASAAP. ASAAP, and it's interesting, and my co-panelists will introduce themselves in a little bit, but Rahim and Mohini have had more experience working with ASAAP than I have, because they've been involved with ASAAP for a much longer time than I have been. However, I'll take this opportunity to say a few things about ASAAP. ASAP started about 30 years ago, 31 years ago, in fact, looking to fill gaps between HIV services, mainstream services that were offered in the city of Toronto, and the gaps that South Asian folks were experiencing when accessing or trying to access those services in a culturally responsive manner and in a language that they can connect with more easily. Since then, ASAP has grown a lot. In the past 5 years, we've expanded to work with Middle Eastern communities, South Indo-Caribbean communities, and more recently, we are now running a settlement program for newcomers to Canada from all the communities that we serve. So that would be, again, South Asian, Middle Eastern, and Indo-Caribbean. So services have grown. The team has grown in the last 30 years. We started, I guess, with a bunch of 4 or 5 people working out of AIDS Committee of Toronto back in the day, to a team of 16 full-time, mostly full-time, a few part-time staff now. And that just shows our ability to successfully work with the communities we work with. And we always place community needs before the programming. Our programming is informed by community needs, let's say. So I'll end there. And Pooja, do you want me to pick the next person?
Sure.
All right, Mohini, do you want to go next?
Sure. Thank you, Praney. So yes, I'm Mohini. I'm the executive director of North York Women's Shelter currently. And in my past, as Praney said, I have also come through, just had the absolute honor to come through ASAP. I was trying to think, when you said 31 years ago, we were celebrating an anniversary when Raheem and I worked there together. And I believe it was the 20th anniversary. So that is 11 years ago, which I cannot believe how quickly time flies. So I was the prevention, education, and women's outreach coordinator at ASAP, and subsequently went on to work at the AIDS Committee of Toronto as the Toronto Women in HIV coordinator, the provincial program, and then went on to become the provincial director of the Women in HIV/AIDS Initiative. And subsequent to that, moved on to where I am now. ASAP was, I found ASAP through looking for organizations to become involved with when I moved back from Montreal to Toronto, and could not believe that there was this organization that specifically worked with and centered South Asian communities living with HIV. It just seemed like such a radical place, and it truly was. And I know in the last 11 years, it's once again changed form and reshaped itself. But truly, I think ASAP for 31 years has just been such a critical cornerstone of the work that happens. And I think as we talk about what we're going to talk about, it's going to come up over and over again. It's just so unique. So yeah, throwing it over to Raheem.
Thank you. My name is Raheem. My pronouns are he and him. I'm a registered social worker and psychotherapist, usually based in Toronto, but today I'm speaking from Winnipeg, or Treaty 1 territory. My journey in the HIV sector has been, it dates back to, I think, 2008. I've worked at Aqua, ASAP, ACT, Quigger, Black Cap, and House of Free Clinic. So just like done the rounds in the service sector. And, some of my most meaningful work has been tied to the HIV sector. And I think that's because it hasn't been, it's not a single issue sector. It has been an opportunity to talk about issues of families of multiple generations, the trauma of immigration, experiences of racism, classism and shadism within our own communities. And we've worked so hard to create space for queer and trans people in our communities. And I have always seen ASAP as like a sanctuary. It was like a nice space where I got to come out and feel safe and feel connected to people. So I'm honored to be here today, speaking on some of these issues in our communities.
Thank you so much, everyone. And so now finally a little bit about myself. My name is Pooja. I go by she, her pronouns. I started my professional life as a physiotherapist and found my way into the HIV community about 5.5 years ago. As I mentioned previously, I'm currently the National Lead Rehabilitation, Optimal Health and Wellbeing at Realize, which I love because it brings together my work in the HIV sector with my background in rehabilitation and my love of physical activity. So it's a nice little niche that I've created for myself here. And then sort of leading into this conversation a little bit more about me. My parents immigrated to the GTA from Nairobi about a few years before I was born. My family held on strongly to their South Asian roots and their South Asian identity. And I was one of the few racialized people in my neighborhood growing up, one of the few who spoke a different language, and one of the few who just couldn't figure out my identity or who I wanted to be or who I was supposed to be. Kenyan, Canadian, Indian, any of the above, none of the above. Everyone has their own impression of where I sort of fit in, and I didn't know what it was for myself. And feelings of not fitting in Canadian or South Asian communities led me to more feelings of isolation and self-stigma and shame. And I didn't, not knowing where I fit in even within my own family, I didn't know where to go to get help to navigate this, since no space felt like my own. And I get the feeling that ASAP has really worked to create that space so people can feel like it's their own. So South Asian communities in Canada represent a diaspora of people and cultures. And while this little story is my own personal experience, many others may have similar stories. As Mohini mentioned in one of our earlier conversations, it's stuck with me till now, is family is so embedded in South Asian culture. And therefore it's a risk factor, but it's also a protective factor at the same time. And this experience of family is one of the many ways that South Asian communities intersect and conflict with so-called Canadian experiences and expectations. And so there's all these various factors and influences in your identity and your space as a South Asian in Canada. And then intersecting that with the HIV experience, it's hard to find data. We've all had this conversation of it's hard to find data related to prevalence of HIV in South Asian communities in Canada, but anecdotally, it's recognized that people in these communities are at higher risks. So looking at all this, what would you say are the factors that lead to this higher risk of HIV for people living with HIV? And what are some ways that you might mitigate the risk? So let's start with Raheem.
Sure, thanks for that. I should say that, when I talk about South Asian communities and HIV, most of my experience is located in the experience of working with gay and bi men in particular, and by and large, like cisgender gay men. And I think from that context, we know that there's something like 1 in 5 or 1 in 4 people, gay men in Toronto, who's not out to their physician or their doctor in terms of their sexuality. And so I reckon that's even higher in South Asian gay men's communities. And so, we are constantly needing to broaden how we understand accessibility of healthcare and sexual health care and information. And I think, it's not just a systems issue. Like, I'm at a place, I think, in my life where I'm not just wanting to blame a system or like a white system, but also wanting to hold our communities accountable, right? Like there's some challenges within our communities around open conversation, around health, sexual health, mental health. And so that work is ongoing, and it's a big risk factor. I find across the board, this is a generalization, but I find for a lot of South Asian folks, information sharing is really challenging. There's a sense of like what needs to stay within community, but also different ideas within families about what should be shared with a physician and what shouldn't. There's like worries about what information can be used against you or how it can affect your immigration status. I've had so many people ask me like things like, if I get a simple STI, a non-HIV STI, like will that affect my immigration status? And I would think, No, why would it? Like, you'll just take antibiotics. It's fine. That's like saying if I get the flu, I'm not going to be able to stay in this country, you know? So there's this like hesitance that comes from a very real place, but that fear and, there's a sense of privacy that sometimes needs to be broken down a little bit or dismantled because it's harming us in some ways. One thing I will say that, when I think about gay men in particular, I remember the Color Matters research study that came out in 2013. It was led by David Brennan. And I've been interested in body image work for a long time. And that particular study, I think I said the date, 2013, it said very clearly that South Asian gay men experience disproportionate sexual racism on online sexual networking apps, and have a tougher time in terms of rejection. And so when I think about social rejection, we can't help but then think about how we might prioritize connection or avoid rejection by not having conversations about sexuality, safer sex, PrEP, etc. Right? It makes a lot of sense that we would, for a lot of us, prioritize access to positive sexual experiences and try to mitigate the negative or difficult ones. So that's some of what comes to mind.
Thank you so much, Raheem. Renee.
Raheem, really, you touched on so many important aspects, right? So when we look at why data is unavailable, because people are not getting tested. Why are people not getting tested? Because they fear this out status that might come with being an HIV positive person or someone living with HIV. Language is very important, right? And so what kind of stigma does being living with HIV come? So if I start coming out to my family or friends or people around me, what kind of additional stigma am I imposing on myself or potentially exposing myself to by getting tested? Or if I was HIV positive, or if I were living with HIV, but because of that, people don't end up getting tested. When people do end up getting tested, they don't, the data is not collected for South Asian folks in a manner that could be useful for agencies like ours, because sometimes racialized data, A, it's not collected. B, when it is collected, we're clubbed with either other groups or Asian. And Asia, South Asia, West Asia is a very diverse, complex geographic situation, right? So it's not easy to understand what that data means. And the task of de-aggregating data falls to us. And we have to make sense of what data is available, the limited data that is available. We have to kind of make sense of that. And then when we look at identifying subgroups within the South Asian population that might be overtly at risk of HIV, it's even more difficult, because what about data for women? What about data for gay men? What about data for immigrants, for newcomers? It gets really complex, and that's where we see that the more intersecting identities you have, the higher your minority stress is, the more chances are that you might be at risk of HIV, is what we're seeing. And then just finding sources of information is a concern, right? When we think of people living in Toronto, there are so many options that are available. But a large majority of South Asian folks are not living in downtown Toronto. Even if you go 5 kilometers outside the core, you start seeing that healthcare providers, therapists, doctors, they become a little less gay friendly, a little less race friendly, a little less friendly towards your accent, towards your ethnic background. And then as you keep moving away from city cores, you see that perpetuate even more and more. So imagine people living in Durham region, or somebody living in Peel region who has a therapist or a doctor who's from the same community, because you also want to connect with somebody who's from your same culture. Are you actually how much can you share about yourself, fearing that this information might be spread within the communities that we live in? So if you have a brown therapist in the Peel region, as an example, what are the chances that this connection might be, and it may not be a real thing, information may not be getting shared, but it's the fear of, the anxiety of that potential stigma, I think, that keeps people from accessing the right kind of information when it comes to sex and sexuality, and also getting tested as frequently or in a manner that suits their sexual lifestyle. So those are the things that come to my mind. Raheem talked about immigration, and that's a very extremely valid fear in especially newcomers and students, because as soon as, if you are diagnosed with HIV, your immigration status becomes questionable. At least you have to fight for it much harder if you were not living with HIV, even though, because at the end of the day, for immigration, it's the cost that that the country would incur on keeping you healthy. That's a very crude way of saying it, but it's the truth of how applications are looked at. So if you are living with a chronic illness, you are judged for how much you're going to cost the public health system. And if you are somebody who's living with HIV, you kind of have to fight a little harder and say that, okay, do I have the ability to support myself? And you have to jump those extra hoops just to get to that immigration permanent resident status, which for a person who's not living with HIV would not have to go through that. So the fear is of immediate loss of either getting deported or their future in Canada, that folks have spent years and thousands of dollars investing into this potential lifestyle that they want to live with. So I'll end there.
Wow. Thank you so much, Praney. Mohini, over to you.
Sure. So I will maybe speak about kind of what I learned from doing prevention education work in spaces that weren't explicitly queer necessarily, and in working specifically with women, most of whom identified as straight. Because, I think something that in the South Asian community, and Pranay touched upon this, just talking about the diversity of experience, right? Like, I think that it can be very easy to say, like, this intervention is going to work with this community, but with South Asian communities, there's so much stratification on so many different identities. There's class, there's caste that still plays a huge role. There's gender, there's sexuality, there's gender identity. Like, there's all kinds of things, and then national identity that really, stratifies our communities. And it's what I really learned in the work that I did with ASAAP in particular was how important it was to be very specific around interventions and really allow the community to be the driver of what works. So even kind of intergenerationally, like I remember going into a community center where there were youth groups, and there was kind of two parallel youth groups happening, and one was for Black youth and one was for South Asian youth. And it was just sort of after school, drop-in programs. And I remember seeing that there was like bowls of condoms that were left out, right, for youth to just sort of grab on the way in. Like, it's really cool, you can grab condoms. And I remember talking to the people who are running it, and I was like, do people take them? Do youth take them? Because they were sitting at the reception desk. And they were like, yeah, the Black youth do. And I was like, what about the South Asian youth? And they're like, no one takes them, And that was very interesting to me, because what it said was, and even though I was in there to do a workshop on, like, I think it was like healthy relationships and healthy sexuality or something, the conversations, like, we really had to be very careful to allow each kind of demographic breakdown to be able to have that conversation internally without feeling like there were outside eyes, and so talking to them, like, how do you access? I mean, clearly this is a group of people who are sexually active, but they needed condoms put into bathrooms where they could just grab them confidentially without feeling like there was outside eyes. I remember going into work with women who had, so these were cis women who had kids in school, so there were moms, and mostly from Bangladesh, this group. And we did an 1.5-hour long workshop on the use of insertive condoms and sexuality and STIs, and we got really far. And in halfway through, I wasn't leading this conversation, I was just facilitating it. So it was very possible to have the conversation, but it had to really be led by community, and it had to feel again like there were no outside eyes, kind of looking into what is considered very private information. And I think with South Asian communities, where sometimes you can feel like, oh, if you kind of worked with one generation in the family, like that information is going to either like trickle up or trickle down like that. That is something where in South Asian families, like there's so much privacy and stigma around information to do with sex and sexuality, drug, substance use, like any of those things, that I think we just have to make sure that anything we do really, again, is led by the communities that and the segment of the community that we're working with. So yeah, the risk factor there, of course, is the level of stigma and the level of privacy that's really important, both as communities that are quite socially conservative. I think we can, just sort of accept that. Plus the model minority anxieties that come along with, immigration. At the same time, I think we have to acknowledge how many South Asians, like how many South Asians in Canada and elsewhere, and including in South Asia, are working in the realm of, sexual health, and are in radical, are activists, are, politically very, progressive. So it's there's also, I think, an understanding that there's just, again, so much diversity. But even for those of us who are working in this field, we're very careful about the way we have these conversations. Most of us, Raheem and I have conversations about not the way he engages his family, but the way we engage our families, right? Like, and I remember having, which was really interesting, an entire conversation about the work that I was doing at ASAAP and the sexual health prevention work with an older friend of my parents at a social gathering. And we had, again, a good 45-minute conversation without mentioning the word condom once, but it was very clear what we were talking about, So again, even for those of us who are in this field, we have to know how to have those conversations.
I just would love to add to that if I can. Mohini reminds me of our tendency to pigeonhole ourselves and like what a spectrum we have in our community. But in terms of risk factors, I think the experience of immigration and a desire for a time capsule form of cultural preservation can really hinder our progress as a community, right? We move into like suburban enclaves, and we're really committed to one another and building community. That's survival. We know that very well. But in a white supremacist world, we also want to preserve our culture. And I think ideas of what our culture are or is becomes very stagnant and doesn't keep up with how it's evolving, even in the places we've originated from. And I think that is a huge risk factor. So I just want to add that.
Thank you, everyone. That was amazing. So many different things that are coming up, but it leads really nicely into my next question. So we've brought up ideas of confidentiality and communication between and within family, but also within the community, and then with health providers beyond that, and sort of like the issues surrounding identity and privacy and stigma. And that leads me to think about this past year. The COVID-19 has impacted people in profound and lasting ways. I was recently speaking to one young South Asian man about the impact of being at home with his family and feeling forced to hide his LGBTQI plus identity from them, and the impact on how his well-being has been far-reaching and has impacted other areas of his life. And thinking about all of that, is how would you say that South Asian communities have been impacted by COVID-19? And then jumping from there, as how has this impacted the risk of HIV, the experience of living with HIV, and or access to resources related to HIV or sexual health education? Mohini, do you want to start us off?
Yeah, I think this is an area where, we are really seeing the ways in which communities in the South Asian community is very disproportionately impacted by COVID. And that has to do with, when we talk about hotspot neighborhoods, or we talk about, hotspot areas, it's all very structural, right? Like these are areas where the built environment is a huge component to why people are at risk. The fact that there's so many members of the South Asian community who work essential jobs who have not been able to, work from home, or are in workplaces where, their health is completely devalued. There's no paid sick days, like all of, or we got 3 or 2 or whatever we got, so absolutely very disproportionately impacted. We know that in Peel region, for example, out in the GTA, just how high the rates are, right? And that it's disproportionately South Asian communities. So during this time, I run a anti-violence shelter, and I think what's worrying to me is that I am seeing less South Asian women, cis and trans women, come through our doors or seeking service, which is worrying, because I'm not, we know that rates of violence, intimate partner violence, are skyrocketing during the COVID pandemic. This happens anytime there's kind of it's like a pressure cooker effect of different pressures on families and on couples and partners. And it's coupled with the fact that people are not sure what their options are. People are having to stay. There's anxiety around housing. And so, unfortunately, there's not data, but I can tell you anecdotally, we're very worried to see the fact that there's almost like a freezing effect of people seeking services at this time. And I guess that I'll just leave it there.
Praney, do you want to add anything to that?
Yeah, that's Mohini, thank you for mentioning, that there are a lot of South Asian people who are currently doing essential work. And let's expand that definition of essential work. There are several South Asian doctors, nurses. There are several South Asian people working at factories. There are several South Asian people doing other kind of people-facing jobs, Ubers, working at grocery stores, etc. And those are all situations where they might be disproportionately exposed to COVID than folks who have the ability, and I would say privilege, to switch over to work from home situation immediately. For some people, it was almost immediate, right? Oh, we're closing the office, don't come to work from Monday. And that was 14 months ago. And some of us have been doing that very comfortably, but that's not the experience for everyone that we are connected with. Some of these folks also live in multi-generational homes. So the idea of isolating is not something that works for our communities, not because we don't understand what that means, but it is impossible because you have families to support. You have that might be, or you might be living with other people in that same house who you're not related to. And that might be because of an investment decision you've taken. And this is what holds truth for you right now, living with multiple people in one house. How do you make sure? So that's kind of been a challenge in the South Asian communities, right? And the other piece is a lot of South Asian people who've moved here recently or otherwise don't have families living with them. We made our own families through our friends, through our work connections, through our social groups. And now, speaking of isolation, first of all, you're not physically connected with your family. Some of them have even severed ties with families back home. So their chosen family here is the only family that they understand of. We're not able to connect with them physically. Some people don't have the ability to the access to technology, I should say, or even the ability to navigate technology to be able to host a wine hour on Zoom that went around quite a bit in the first early months of the pandemic. It's a very, I would say, middle-class white perspective to say that, oh, working from home, I really like it, or, it was easy breezy for me. It was interesting not to show up to work the next day. Oh, that was, it didn't take a while. Yeah, I find it more comfortable working from home. No, what about people? Actually, I know people who do the kind of work we do, but now that they live with families and they're not able to do the work that they did simply because how do you have private conversations about sexuality, about sexual health, with your clients if one of your deliverables is to do one-on-one sessions, but you live in a multi-generational home where you perhaps don't have that office space that we all imagine everyone has. So there are multiple realities outside of the, oh, I have this nook and I bought this automatic table, I bought this ergonomic chair. That's a very privileged state to think of. And when people say that COVID might end in a couple of months, in a couple of months or a year from now, that's also an extremely privileged statement. I think for our communities, COVID and the rippling effect of what the pandemic has been in the last year is not going to go away for many years to come. The significant impact it's had on our work life, our social life, our finances, our mental health, our ability to be in the outside world and say, okay, I can be part of the workforce. That's been taken away, and it's going to take a much longer time for certain sects of South Asian population, especially newcomers, I would say, much longer time than usual to get out of this, even when the so-called pandemic, even when the pandemic so-called gets over. So I'll take a pause there, but there's so much more to be said about this.
Yeah. Raheem?
Thanks for that. You know, both Pranay and Mohini, you have both reminded me of just how important it is to think about the class differences of our communities. And when you both talked about essential workers, you know, there's many of us that are nurses and doctors, and there's many of us that are in working class jobs. And we're all impacted by the pandemic in a different way. And I appreciate just acknowledging that. I think in a lot of the work I do, which is, you know, one-on-one psychotherapy, I've been really during this time feeling for clients who you know, they spend a lot of their therapy session talking about the extreme isolation and disconnection from their families. So if their families are back home, in like at the moment for the folks I'm working with, that means India or Pakistan, they're quite worried about COVID. They're quite worried about their family's health. And oddly, you know, they're also frustrated because conversations are still in the realm of like, what's going to happen now that we have to postpone this wedding? And so there's a frustration because for folks who don't know, you know, I think we have a crisis of imagination in our communities that we need to really work on. And, you know, we need to think outside, like life outside marriage and children, like there's more to it. And I find it personally, like I have a strong reaction when I think, oh my gosh, I'm saying to my client, you're worried about your family dying and not paying attention to rules. And your family's asking you if you're like, you know, if you're dating anybody. Like it's a bit outrageous, you know? So I just want to put that out there. Like this is the context of our culture and community. And I'm highly critical of it in many ways. Having said that, I think that I've seen in my own family, an effort to reconnect over Zoom. Now I am talking about like a mostly middle class experience, but people who have a lot of hesitancy around technology have like been forced to accept it as the only way to stay connected to their siblings and their kids. And you know, around 1 year ago when George Floyd was murdered, that was the first time I think my family had conversations about anti-Black racism. And the first time like there was a context in which like I could bring up things like just how we are shadist and anti-Black in our own culture, because I think there was an immediate like defensiveness or disconnection. And I think the world being on this pause, so to speak, was helpful, I think, to just have those kinds of conversations. A couple of, you know, when I think about queer and trans people in South Asian communities, trans folks who have often needed, many of whom need, you know, life-affirming, life-saving medical transition services have had to wait. Like they've been considered elective surgeries, and all of that has been put on hold. And while that makes sense for, in terms of prioritizing COVID-19 patients, the pain and suffering of having to be in limbo and to have to just struggle with prolonged uncertainty around the medical transition process can be really difficult. And another community that I think kind of went underground a bit were people who were engaged in sexualized substance use. So particularly P&P communities, or otherwise known as party and play communities. Like if you're very used to pairing drugs and sex, it's really difficult to participate in the more general public conversations about risk reduction and safety, because self-isolation doesn't feel like as much of an option for you, and you're just operating in kind of a new, like in a sub-community or an enclave, and it's hard to know what risk reduction even can look like in the context of COVID. I will say though, for folks who are not in the P&P scene, but are like gay men trying to date, and I have heard some positive things where people say like, oh, with everything on pause, I'm slowing down and I'm getting to know people, or there isn't a pressure to meet people right away, the same day, the day after. There's like, we're just chatting on Zoom, or we're texting for a longer period of time, and then we're meeting for like a distance park walk. And there's something about the conditions of physical distancing and the self-isolation requirements of the pandemic that have allowed people to shift the norms around hookup culture in our communities. And I think there's like, hooking up is great, but I think this is also kind of nice. Like, we get to experience connection in a different way and have it express itself in a different way. So those are just some of my thoughts.
Thanks, Raheem. You actually just answered one of my follow-up questions on how dating culture or app dating culture might have shifted during COVID. My next question, specifically jumping off of what Praney was talking about, so it's for you, Praney. You've talked about sort of in general what happens or what South Asian communities might be experiencing and sort of the class differences. Have you noticed anything during COVID for your clientele at ASAP, and how it's impacting them on the services they are seeking or not?
Yeah, I mean, initially there was as expected, there was high levels of anxiety around what's going on, right? So nobody knew what was going on back in March, what it means. Am I breathing the right kind of air? Am I supposed to stay absolutely inside? Can I go to the grocery store? So there was a lot of anxiety, and we were getting calls just wondering what was going on. And so we have to, even though we're in sexual health settlement agency, the level of trust that our clients have on us is what brings them back to us. And even for COVID-related concerns, they were calling us and not public health directly or their doctors, right? Because you have that rapport, you have that connection with the clients. So we did receive a lot of, initially we did receive a lot of calls from our service users and clients. There were newcomers coming into Canada throughout, which then became a problem, became a concern, because we were not able to connect with them, or they were not able to connect with us as seamlessly if we were not working remotely. So for example, in a regular year, it would have taken a newcomer through word of mouth, through our advertising, our promotions, our event planning, maybe let's say 3 to 6 months to make that initial contact with us. That time frame expanded to something like 6 months to a year, let's say. So there is a lot more time that newcomers especially, took to connect with us, which is a critical point of time in any newcomer's journey, because it's the first 6 months is when you go through a lot of depression, anxiety, buyer's remorse, moving to a new country, feeling isolated, not being able to connect. And when the initial high of, oh, I've arrived gets over, that's when reality kicks in and you're like, oh, maybe it's not as glorious as I thought it was. Eventually, things even out for a newcomer. Mostly, people say in about a year to 3 years, that's when you start feeling a little more settled, but the initial first 6 months are very critical. So that was a concern. Then, as I said before, that for a lot of people, and we immediately switched our programming to Zoom, phone, and other forms of online support. But there were a significant number of people who didn't know how to use a smartphone or couldn't use a smartphone to connect with a social group or a support group from their living rooms, because their partners might be in the same room, or their kids might be in the same room, or other family members might be in the same room. So how do you have those conversations when you don't have the luxury of privacy, or you don't know how to use a smartphone, or you don't have that kind of internet bandwidth because you can't afford? So affordability, it's all so connected that it's really hard to tease out these individual concerns that people might have had. That said, what we did was to offer multiple ways for our clients to connect with us. So instead of only focusing on Zoom calls, we also talked about reach us on Facebook, or a separate phone number that was given to each staff person, so they could be contacted they could schedule a time to call a staff person instead of only focusing on work hours. And people at ASAP were told, flex your hours. If you're feeling that you need to be taking more time during the day to connect with your family, to cook food, run errands, because you're not going to be able to stand outside no frills from 6 to 8 p.m. because that's how long the lines were back in the day. Take some time off during the day, do your thing, come back to work. And if that helps your service users connect with you in a better manner, even better. We also provided people the option to sort of come into one of the meeting rooms at ASAP, where you could be provided with a tablet. So you could join a session isolated, but you could join an online session if needed, and nobody else would be around. We'd set you up with a tablet or a laptop, leave the room, you can come and sanitize it, attend the session, let us know, we'll come back and take our gadgets away. So it's really, again, so much about listening to the community and being responsive, as opposed to thinking, oh, let me see how I can hi-fi my my existing programming and make it very tech friendly. But is that really working for the communities or not? So that, again, that piece around isolation and how that was even further stretched last year, we'll have to ensure that those gaps are not getting further expanded, but are getting filled in a manner that makes sense for service users and our clients.
Perfect, thank you. Mohini, I wanted to sort of build on what you said as well. You mentioned that you'd seen less South Asian women accessing the services. Were you, I know it's different when you're working with the population that you're working with, but were you able to find new ways to do some outreach to those communities, or how did you sort of navigate that?
Yeah, that's a great question. Actually, we kind of noticed the dip. I wouldn't say immediately, but like soon into the pandemic. And sorry, my dog has decided this is the moment to come and bark at me. Yeah, we got together with a few of the other anti-violence shelters and did a coordinated outreach project. So I think it's called Still Here TO. And it's, you know, communicating we looked at the languages of communities that are most overrepresented in shelters, and 3 South Asian languages showed up, you know, and so we made sure that it's translated, did some targeted outreach in those communities. It's Toronto focused, but then we also partnered with the anti-violence movements in the rest of the province that were interested in adapting that. So that was kind of one of the kind of interventions, and not to say that there aren't any South Asian families or survivors coming in. There are, but you know, something that I will say that I think we have a long way to go with kind of mainstream services. Like, I'm not in an ethno-specific organization anymore. Is where those gaps are, make things like disclosure, or, you know, engaging with things like testing, with even asking for the services that someone might actually need very, very difficult. And so, that's where I just want to shout out the massive protective factor that ASAP provides and why it is such a critical resource. I have never seen, and I asked this in the prep, like, how is the specifically because I'm here to talk about sort of women in HIV, but like the women's kind of program going at ASAP, like our women's new clients coming through as, service users of ASAP. And the answer is yes. And yet, I'm in the anti-violence, women's sector, and I can't tell you, I think there's been one disclosure of HIV, not a South Asian woman, in the 5.5 years I've worked at the shelter. And that is just not possible, that, there's no one with HIV coming in, particularly because we know that violence, intimate partner violence, is a risk factor in heterosexual relationships and actually any intimate relationship when it comes to HIV. So I think we do not do a good job of creating safe spaces around disclosure when it comes to HIV in particular. And the model where you have this it's not just cultural competency, but it's like this understanding of what a community needs to feel safe, and providing that and being very, and in the South Asian context, because that's what we're talking about, when we talked about families being a risk and protective factor, like that's where that sense of chosen family can be a massively protective factor, right? There's a way where that feeling of community that is accepting and supportive and safe makes such a huge difference. Whereas in an anti-violence shelter, or a hospital room or an emergency room, like saying, oh yeah, your information is confidential here, but there's just such a kind of bureaucratic, medicalized or like institutional kind of response that doesn't take care of the whole person. And you expect, someone with something that is so stigmatized, potentially living with something that's so stigmatized, to then disclose is a really tall order. And I think the silence around it is massive, right? So even things like getting safer sex materials or harm reduction material into shelters still in 2021 is such a challenge. The approach that the HIV sector takes, where it's survivors people living with HIV, or fixing my sectors, people living with HIV, nothing about us without us, JIPA, MIPA, all of those things are non-negotiable. Whereas, that is a long, far cry from other sectors, including the anti-violence sector, where, it's not very survivor-led, right? And it's quite institutional, and that has massive consequences for safety, disclosure, trust, and all of those things. And returning to situations that are high risk, returning to violence in the home, returning, to and not being able to seek the supports that someone might need if they are at risk of HIV or living with HIV.
Thanks, Mohini. That answer led us perfectly into the next question that I had for the three of you. Sort of that you all have the shared experience of having previously worked or currently working with ASAP. But since then, you sort of diverged and have different experiences and professional paths. So what are the issues that you see that intersect with HIV, specifically for the South Asian communities that you work with? And so, Mohini, you've already started answering that question when it comes to intimate partner violence and the way that the anti-violence sector is sort of institutionalized. So I wanted to jump over to Raheem and ask him about, I know you work with some organizations that are specifically for Muslim gay men, and what are some of those issues that you see that are sort of go broadly with your communities and that intersect with HIV?
Sure. Yeah, so I do a lot of community organizing with an organization called Salam Canada, a volunteer-run national organization. And, of course, LGBTQ Muslims are it's a much broader category than South Asians. But in South Asian communities, I think we struggle with what it looks like to have like sex positive families, or to raise kids in a sex positive way. I think people are trying and people are doing it. I see people in my life, with their kids, they're doing a great job, but there's there's a struggle, there's an intergenerational pressure around things like gender conformity. And it starts really young. And so I think like it's always been bizarre to me that we are completely desexualized and we don't talk about like dating, lovers, romance, anything, but like marriage is important and having kids is important. And like, I don't know how the kids are supposed to happen without the sex part. And and if the sex is supposed to happen, like why do we not talk about like ourselves as sexual beings? So I would say that some of our challenges are like wrapped up in these ideas of shame and modesty and preserving our bodies in a way, there's a lot of emphasis still on like virginity. And I hear even for gay men, for maybe whom you would think that these concepts don't even apply. I've heard gay men in my counseling practice and peer support space to say things like, well, you want to have sex with a good number of people so that other men see you as experienced, but not too many people because then they won't want you. And I think, oh my goodness, this is kind of, it's quite bizarre, the mental gymnastics we have to play to think about what our currency and value is. And I think, so when I think about our populations, whether it's queer Muslims or it's South Asian people or the overlap of those two, I think we really have to think about, challenge our own communities and families to think about sexuality in different ways, and even imagine what our lives can be in many different ways, right? Like if people come out in their families as queer or trans and they get acceptance, but that acceptance looks like, okay, I accept who you are, but now we're going to focus on the marriage part again. Like it's a bit of a miss, or like, great, you are queer, you can bring your partner, we're going to do a community Bhangra session or whatever. Like that could be nice, but it could be a miss, right? I think there's a queer way of being in the world. We, as a result of being marginalized, we see the world in a different way. And I think we want to rewrite some of the scripts, right, of what our lives can look like. And we need our communities to move forward around those things with us. And I think that's challenging. I think when I'm in meetings of where multiple ethnic groups are represented and there are white people at the table, we have this habit as service providers to say, well, in our communities things are like this, in our communities things are like that. And I think by constantly having to respond to like white supremacy, frankly, we essentialize ourselves. We categorize ourselves as stuck and not having any movement. And I find that like particularly challenging. And I don't know what to do to break free of that, right? The other piece I just want to mention is also that, sexual health is so important, but one thing that ASAP has always done is it hasn't led with just sexual health information. Like Mohini had described, talking about like healthy relationships was the entry point. And for other folks, like Praney is talking about, like we're entering with the issues around settlement. So I think we have to really think about what those entry points are and make sure we include, like, sexuality is part of all of those things, And so I think embedding that in our work is really important. I've always seen ASAP as an organization that, while it has HIV/AIDS in the name, really does a lot of anti-homophobia work and does sexuality work. And I think as the landscape of HIV changes and has changed, like I think ASAP had it right all along, like that we really need to do, like, prevention work is sexuality work and anti-homophobia work. And of course, anti-homophobia work is anti-sexism work. And like all of that is stuff that needs continual work inside and outside of our communities.
Thanks, Raheem. Praney, could you touch a bit about some of the issues you see related to newcomers and HIV risk?
Sure, and thank you, Raheem. That was just incredible what you shared. Yes, Pooja, in a second, but let's take a step back. When we think of HIV, it's not a concern that only it's not a concern for just the people who are living with HIV, right? It's a concern for communities at large. It does not become your issue only at the time if you are diagnosed with HIV. It affects our communities. It affects our family members, friends. It affects our people that we work with. So it's not a gay issue or, for example, in South Asian countries, it's mostly amongst sex workers and truck drivers. So it's not really just about that. It's not about isolating and thinking that HIV is a gay concern or a brown concern or a black concern or a XYZ concern. It's something that impacts us as a society as a whole, right? So it's not, we have to take a look at HIV from this intersectional perspective to begin with, if that makes sense, right? So all our identities are intersecting, our health concerns are intersecting, therefore HIV itself is intersecting. When it comes to newcomers, the question again is, and we were just talking about immigration a second ago, how many newcomers are ones who are trying to move to Canada because they are living with HIV in their home countries? What does their journey look like when they move to Canada? Again, the route is very different. It's a bit more problematic. It's lengthier. There are so many more hurdles that you have to cross. You actually never sometimes even know which country you might be placed in, because the idea is to help refugees. For some organizations, the idea is to take you to a safe third country. So if you've been thinking of moving to Canada, that's information that you might have received just months before you move here, as opposed to somebody who's been working towards moving to Canada for, let's say, about a year or so, or 2 years, thinking, oh, I'll go to school or I'll immigrate as a federal skilled worker, and this is how my life is going to look like. At the same time, when you don't have those connections established, and that is further enhanced for queer people, because as most brown straight folks will, I'll say this shamelessly, but we tend to know people, a lot of people. So for straight people, it's easier to connect and be like, oh, I have this uncle, this mama, chachi living in parts of Toronto. When you move there, connect with them. So you're offered this immediate family day one, or even day -1. You know that this is going to be my first source of support as soon as I land in Canada. For queer people, you may still have those uncle, aunties, chachis, mummies in Toronto, but would you want to connect with them? How much would you want to connect with them? And can you actually ask those extended relatives, hey, where does one get a sexual health exam here? Or how do I get tested for HIV? Had sexy sex last night? Not possible. But so if you're not connected with your queer communities, then how would you find information about sex and sexuality? Now, within the queer communities, you might feel isolated due to a racial discrimination from the mainstream queer communities because you're not white enough, you have a very fobbish way of looking at life, you have an accent which is very strong, or you might be fetishized for all of the above. Do you feel at home with the larger queer communities? Maybe, maybe not. Do you feel at home with the larger South Asian community? Maybe, maybe not. And those are the points where people fall through those cracks. And that's where I think agencies like ASAAP should be focusing more on. We already do, but there's so much more. I want to have a kiosk at the airport and be like, hey, if you're brown and gay, see one of my staff people. Not that we're not moving towards that conversation, but it hasn't realized yet, right? It might not happen for the next several times because we're talking about bureaucracy. But those are the places that, I mean, we're smiling we're smiling because we understand what we're saying. Like I see Raheem and Mohini also chiming in. It's like, yes, all the uncle aunties and those conversations are difficult, but that's the truth, right? There's an added disadvantage that queer newcomers arrive with to begin with from South Asian, Middle Eastern, Indo-Caribbean countries. And I'll take 30 more seconds and say that Also, when you experience those forms of racism, sexual racisms within the mainstream queer community, any opportunity that you might get to have sex, because you're facing a lot of rejection from the mainstream community, a lot of guys might be saying no to you for sex, but the one person that does want to have sex with you but does not want to wear a condom, or is wanting to, or not very out about PrEP, or just not having the kind of sex that you would want to have, you agree to it because you never know when the next opportunity might be. And oh my God, I've been in Canada 6 months, I haven't had sex. I thought I'd be having sex every weekend day, I don't know. But when that happens, when you jump into precarious situations without thinking of your own good, not the truth for everyone, but that does happen. And that's where the problem lies, right? So and that's why it's intersectional, it's integrated, it's systemic, it's structural, all of the above.
Thank you. That was an amazing answer. Recognizing that we're nearly out of time, I wanted to just throw in one question that we have from the audience. And because you all have sort of some experience with ASAP, I'll send it to Praney first, but if Raheem or Mohini would like to add anything, please feel free to do so. Has ASAP ever envisioned itself doing national work with South Asian communities across Canada? If so, what could that look like? And if not, why not? And this is such a relevant question because it seems like you're the only ones doing what you're doing. And yeah, so what would a national version of you look like?
So again, just to recognize, I feel Mohini, Rahim have been involved with ASAP much longer than I have. So I'll say one quick thing and I'll end there. And I'd love to hear from Rahim and Mohini if what has been the conversations in the previous years that you were more closely involved with ASAP. But part of the reason is there's always a fear of how that would impact the strengths we have at the moment. So if we end up going pan-Canadian, we want to make sure that we're not dissolving the strengths that we currently have. This conversation around going pan-Canadian has happened, and I do believe there are considerations from funding perspective that we have to be mindful of. That's one. That said, more recently we've started working, we're doing this needs assessment project with South Asian, Middle Eastern, Indo-Caribbean folks, queer folks throughout the country, and service providers of the said communities to understand what those gaps are. So slowly through our expanding the scope of our work, we are looking at pan-Canadian issues. So that's one piece. The second piece is we constantly try to work with other South Asian organizations that are, let's say, in BC, in Montreal, and the Prairies, and Halifax, or if there are any queer organizations. I don't know if I already said that. So South Asian organizations in those places and queer organizations in those places to be able to fill those gaps for them from a capacity building and training perspective. So there has always been some work with other provinces, other cities throughout Canada. It's just that we don't have offices, physical, or virtual offices anywhere outside of Toronto at the moment. But that's not off the table. If I would wish that we have more offices and more real-time presence across the country very soon.
Thank you. Mohini, Raheem, would you like to add anything?
Only to say that I don't know that I have the information. I was in a not in a leadership capacity at ASAP when I was there, but one thing I would say, and I think Pranay touched upon this, is like really the strength of ASAP that I experienced anyway was just its deep community roots, its community building, organizing, like all of that. The fact that it was a physical place that you would see, people dropped by, like people dropped in to hang out. Like there was just like all of this, so that the specificity is really, really important, I think, to the approach, and the fact that it actually builds family. Like it really was one of those spaces, especially in these gentrifying cities, right? Like globally, nationally, whatever, to still have a place where you can just come and hang out and have a snack or just have a chat, and then there's a party, then there's services. Like all of these things are just so important. So with any approach, I think if that ASAP model was to be what, like not just ASAP supporting, HIV and South Asian community work, but I think that model would take like that specificity of real located in the community. And yeah, I mean, I'm sure folks to take up that work, but it's just so specific, I think. Mhm.
Thanks. Raheem, anything to add?
I'll just add that, I think as the idea of ASAP, expands, there's so many models that we could borrow from, but it's before going across the country, I think there's like also, and not to say that ASAP hasn't done this, not at all, but like just stepping outside of the downtown core and really having like, like an ASAP employee, an outreach coordinator, an outreach worker, whatever it is, stationed in various like regions, so like, Durham and Kitchener, Waterloo, and whatever, to continue the work. I also wonder what all of that means and looks like in a COVID world or a post-COVID world, if there is such a thing. You can expand and be national and not move. So I wonder what community organizing will actually look like moving forward. And in particular, when I was at ASAP, I was an outreach coordinator, which meant that I supported volunteers to do some outreach, and then I did a lot of it on my own. And the spaces in which we did that outreach work, some of them don't exist anymore, like bathhouses, for example. Bars are disappearing. So I'm thinking about, what meaningful space looks like and what does outreach even mean? And if it's all, and maybe we'll say, it's moving online and there's easy ways to, to provide services in a virtual platform. And as much as I get excited about the possibility, I take a moment to like mourn the loss of our spaces, like our city is like, I also loved Toronto, and it's not affordable for a lot of people, and coming into the city continues to be like the safe place outside the suburbs. So I think we like something needs to change there before it gets bigger.
Praney, last words.
Yeah, no, thank you, Raheem. That's so valuable, right? And we also need to take a minute and say, okay, well, what about now that we're living in this virtual reality almost? But just to end it off and say that even though we've not been present physically in cities outside of Toronto, but we always, and Raheem, at some point, I was also the men's outreach coordinator at ASAP a couple of years ago. And we would receive Facebook messages or emails from other Canadians outside of Toronto. So the work has happened, maybe not in such organized fashion that we have held spaces, support spaces, or physical offices in different countries. But the outreach effort that we've done for the last 30 years and the service delivery that we've done for 30 years has really connected us to people even outside the Toronto area. So unintentionally and in not such a organized fashion, but the work has expanded quite a bit throughout Canada. And I would say even from the States, a lot of people communicate with us directly from the global South because they know us. And as I said, I would wish that we become, we expand geographically or virtually geographically. I don't know, is that a new word? Can we start using that? Very soon.
Okay. Thank you so much, everyone. It's been, I was worried we wouldn't we wouldn't have enough, we would have too much time, and now we don't have enough time to have all the conversation that we want to have. So I really hope this is just the first of many conversations related to South Asian communities that we haven't realized. My two takeaways from today are the importance of community, and what that means and what community might mean moving forward with COVID, and also intersectionality, and that every single one of us is an intersectional being, and how that impacts the way we move through the world, especially for South Asian peoples. It impacts a lot of who we are and why we do it. So yeah, thank you so much. I really appreciated all of your thoughts and input. As I said, this has been recorded, and we'll hopefully have it up on our Realize YouTube page shortly. So feel free to share for anyone who was able to attend, and hopefully we can chat again soon. So thank you.